Sit in the last. Go to the last bench. Today we are going to do grams training exercise, and here onwards we will start practicals regularly until your university examination. So there won't be any holiday for internal assessment. Morning we are going to take class. Afternoon you have to 2 to 5 you have to write the theory on 5th, 6th, 7th I think, whatever it is. And subsequently we have two papers and practical on we are divided into 6 batches depending on that. Mock examination just like university examination you have to appear. So the probable question I will be putting every day one essay question. Out of those essay questions will come. Okay. So same thing with non-Cbme people also. Same 4 questions will follow. Practice, write down, and the same questions will come. First we'll put 10 marks question, 15 marks question, then 5 marks question, 15 marks question 2, 5 marks question 10, then 20 MCQs. That is the first, second internal assessment. Third internal assessment, it's paper 1 and paper 2, just like how university examination will be there. That is it. Practical grams, Z-license training, spotters, applied exercise, 1 ATCOM and 1 OSPI, and 1 stool examination. These are all the practicals. 20 marks for the Viva. 4 examiners will be there. 5 marks each. 20 marks. And please remember, all of you should pass in theory. Then 50% marks you should get in theory. That is your job. Passing in practical and Viva is my job. Okay, clear, make it clear. Is it clear? Are you having any doubts? Any doubts about anything like that? Any doubts about examination system? Any question you want to ask? Any question? Any doubts? Is it clear, or you want to? Any what is that? Some doubts? 15 marks question 2. Most of them will be, they'll give a clinical scenario. A 20-year-old boy comes with a coated tongue, hepatosplenomegaly, rose spots, step ladder type of fever. What is your probable diagnosis? What are the organisms that cause this infection? Then on examination, there is a palpable liver and spleen, rose spots, step ladder, all these things. It's all problem-based question which I'll share with you. Okay. And at least by the end we should be able to answer. इतना क्वेश्चन आंसर करना, इतना क्वेश्चन आंसर करना तुम. The question paper should be scared of you. Don't do all this. No, don't do that. Oh, Venkatramana, please help me. Don't do that. Huh? Which one? First they will touch like this. First open question paper opening. Other fellow will be telling. Yeah. Oh, today's is a 20 marks question in your examination. Everybody has to focus and show this. Grams training. First thing, the question that will be asked is, why do you do grams training? Your answer should be, sir, you should. There is a manners and etiquette in your examination also. Girls, if they smile sweetly, they'll get 2 marks extra. Boys, if they wear new apron and put some perfume and nightly shaven and what hairstyle? Rakesh, where is Rakesh? Show me. No, it's not good. Very bad. Bloody, he looks like a rowdy. अच्छा शेव कटिंग करके आओ, सब जेल गिल लगा के अच्छा से आ जाओ. Very. Show me. Okay. Presentable. So put some nice perfume and give broad smile. Even if you don't know the answer, just give smile. So, don't make crying faces. So first answer, why did you do grams training your son? to differentiate between your answer should be, sir, it is done to differentiate the gram positive and gram negative bacteria. Okay. So what you recite with me. Principle of gram staining is to differentiate between gram positive and gram negative bacteria. It's a differential staining technique discovered by Hans H-A-N Hans Christian Graham, not Nayak. Hans Christian Graham in 1884. He was Danish microbiologist. So first it was employed to see Streptococcus pneumoniae in the lungs. Okay, lung tissue. Okay. Now procedure, make it very simple. So sometimes we ask, first, whatever may be the samples, sputums, urine, CSF, whatever the sample, it is still considered as a gold standard in bacteria. Even if you appear for USMLE, FLAB, and whatever exam go down, if you go to USMLE examination, where you have to collect the sample and do the smear and stain with yourself, most of the hospitals have bedside laboratories. Okay, so you have to make a smear. Smear should be so thin you can read newspaper through it. Smear is like putting a dosa on tawa. What? Manjula Devi. It is like putting dosa on the tawa with the inoculating loop. With what? Inoculating loop. Spread the smear and mark underneath with glass marking pencil. What? Glass marking pencil. On top, we have to write gram stain and number, whatever IPOP you have written. If you go, it's only examination now. If you do post-session, we'll teach you how to mark and all this. Always stain on the proper side. If you stain on the reverse side, what will happen? Rajat. On the back side, if you stain, what will happen? You'll not will be able to see. Will end up breaking the slide. You press so much, thun आवाज will come. Boys usually लगाओ चक्कर चोरी करता है बाजू के लोगों के से. Girls start crying or last one more slide and down. So that's usually routine. And how to make proper side you should see, and if you just clear it, it will clear it. On the upper side we mark with G, like okay, that is smear. Everybody, smear is fixed to the slide by passing over the flame. Heat acts as a fixative. One, it fixes smear to the slide. It fixes smear to the slide. It fixes smear to the slide. Number two, it kills microorganism without altering the morphology. It kills the microorganisms without altering the morphology of bacteria. And it makes clinical specimens safe for the person who is doing it. It makes clinical specimens safe to the person who is doing this. Once it is fixed, and you mark underneath, and top you write grams. Okay. Now everybody recite with me. Gram staining is a 4-step procedure. How many steps? How many steps? Gram staining is a 4-step procedure. Gram staining is a 4-step procedure. So first step is the primary stain. Everybody, first step is primary stain. First step is primary stain. Usually the violet is used as a primary stain. Everybody, violet is used as a primary stain. First step is a primary stain. First step is a primary stain. First step is a violet. Junction violet, crystal violet, methyl. Everybody, mention violet, methyl violet, crystal violet. Any violet can be used. The violet is a primary stain. 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 Violet is a violet stain. Next is mordant. The Gram's iodine is a mordant. Gram's iodine is a mordant. Hold, put like this. Everybody, not like this. This mordant. It fixes dye to the cytoplasm. Everybody, it fixes dye to the cytoplasm. It fixes dye to the hold. Everybody do it. Fixes dye to the cytoplasm. Fixes dye to the cytoplasm. Dye to the cytoplasm. Third one is decolorizing agent. Alcohol or acetone. Alcohol or acetone. Alcohol or acetone. Alcohol as it is called as decolorizing agent. It is called as decolorizing. You put drop by drop until faint color remains. Alcohol, everybody, alcohol, decolorizing agent. Then counter stain. Either dilute carbamazepine, or safranin. We don't use safranin. We are using dilute carbamazepine. We are using dilute carbamazepine. So in steps you can. So these are the 4 steps: violet, iodine, alcohol, dilute carbamazepine. Don't bring small chitlets. There are bottles kept. First we have put violet, second we have put iodine, third we put alcohol, fourth we have put dilute carbamazepine. Rows we have put. Don't try to if you want to तुम्हारा friend को fail करना है तो bottle change करने का. Dilute first, violet last. लास्ट में क्या सब violet आ गया fail होता है. But every condensation nobody is going to fail. Take assured from me. Unless you do a very gross mistake, you are going to fail. It's only a part of your exercise. Okay. And it is very important because when you become a doctor, you know the importance of gram staining because the various antibiotics which are clinically used, it's a gold standard. Gram stain is a gold standard when you start prescribing antibiotic. It will teach you in pharmacology what antibiotic for gram positive, what antibiotic for gram negative. There are certain drugs which are called bacteriostatic, certain drugs which are called bactericidal, suicidal. That is, which kills is called cidal, which suppresses the multiplication is called static and cidal. So you have to first step you have to cover the smear. Everybody cover the smear. With junction violet for 2 minutes. Cover the smear with junction violet for 2 minutes. Cover the smear but with junction violet for 2 minutes. Cover the smear with junction violet for 2 minutes. Number 2, add grams add wash with water. Wash with water. Cover the smear with grams iodine for 1 minute. Cover the smear with grams iodine for 1 minute. Cover the smear with grams iodine for 1 minute. Wash with water. Decolorize. Everybody, decolorize with alcohol, absolute alcohol. Uh, Drop by drop until faint color remains. Decolorize, decolorize, decolorize with absolute alcohol. Drop by drop until faint color remains. Counter stain, counter stain with dilute carbamazepine for 30 seconds. Wash, blot dry, see under oil immersion microscope. Everybody, wash, blot dry, see under oil immersion microscope. What are the adjustment of microscope under oil immersion? Hundred x objective. 100x objective. Oil immersion is how much? 100x objective. And if you keep your smear here, you put a drop of oil, and you should touch. You should touch. Everybody, you should touch the smear, and with the coarse objective, lift up, until a faint color seen. Until you see faint color. Then, with fine adjustment, there are two adjustments here: coarse and a fine adjustment. Until a faint color seen, then with a fine adjustment you adjust. Then you see coca and bacilla, whatever you see, you have to write the diagram. Beg, borrow, steal one round color shaped so that you can write nice round bangle, compass, or whatever it is. Nice round. Some people write some triangle, some rectangle. These are not allowed. Nice. How do you go? You got a girlfriend? No, not yet. Start looking for it. Okay. Okay. Nice round bangle. You can buy one. Bangle is how much it costs? Not even 2 rupees, I think. Venkatesh. Where is Venkatesh? Venkatesh. 2. Okay. Now, nice round you see, whatever you see. Now you have to write nice diagram. And you should write solid cockeye. Like this. Solid cockeye like this. Not like this. No, so many diagrams they write like this. This is code in Kannada. I don't know what you call in Telugu. Some spicy like chakli and this thing. So write solid because everybody write solid cockeye because cytoplasm gets stained. What? Cytoplasm gets stained. Cytoplasm gets stained. Now you write observation. Observation. Violet colored cockeye. Pink colored bacilli. So report you should write gram positive cockeye. Everybody, gram positive cockeye arranged in clusters and gram negative bacilli are seen. Gram-negative best layer seen. So please bring HB pencil, eosin pencil and violet pencil and one nice and one blue pencil. These are a must. Okay, all of you should carry hall ticket during the final NTR examination, your record books and log books. So these are a must because log book and your record books carries 5 marks which are added in your practicals. Okay, very important. So unless you complete record book and log book, you will not get entitled for that marks. Okay. Once you write this diagram, focus it. What you should do? What you should do? You should raise your hand like this. How? Hold it. Raise. Everybody raise it. Sir, I am ready with gram stain. What you should say? So I'll examiner will come whatever allotted. Different date, different examiners are allotted. They will come. First question I'll ask you is they'll look at the smear whether you stained are properly and look at the microscope. Then they'll take it and do a signature there. Then they'll ask. So they'll ask same question. Why do you do gram staining? You have to say it's differentiate between gram positive and gram negative. So they have to say gram positive organism take violet color. Some organism like gets decolorized and take up the pink color. Then last, why some organism retain the primary color? Why some organism get decolorized and take up the counter stain? This is explained by Gram's postulate, Gram's reaction, mechanism of Gram reaction. So what are those Gram reaction, Gram's postulate, mechanism of Gram reaction? Why some organism retain the primary color, remain violet in color? Why some organism gets decolorized, take up the counter stain? These are explained by Gram's postulate, mechanism of Gram reaction, postulates of Gram. Number one is cell wall theory. Everybody, gram positive cell wall is 40 times thicker than gram negative cell wall. Gram positive cell wall 40 times thicker than gram negative cell wall. Gram positive cell wall 40 times thicker than gram negative cell wall. Next theory is gram negative cell wall is complex. It is made up of outer layer, which is made up of lipoidal layer. It has got lipoidal layer. Alcohol, which is used, gets dissolved. It dissolves the lipoidal layer, and iodine complex comes out. So repeat with me. Gram negative cell wall is complex. Thinner. It has made up of outer layer which is made up of lipid. During decolorization alcohol, the iodine complex comes out and takes up the counter stain. Look pink in color. Very good. Next is pH theory. Gram-positive cytoplasm is acidic in nature. Gram-positive cytoplasm is acidic in nature. Cytoplasm is acidic in nature. It has got more affinity, प्यार मोहब्बत इश्क towards basic dye. Gram-positive cytoplasm is more acidic. It has got more affinity, प्यार इश्क मोहब्बत towards basic dye. Third one is chemical theory. Gram-positive cell wall has got two special chemicals, magnesium ribonuclease and thicoic acid, which makes the gram-positive organism retain the primary color, which is violet. And in the end, gram-positive organism looks violet in color. Gram-negative organism look pink in color. Remember 2000 rupees note. It takes the color of. Don't keep 2000 rupees note. It is going to be withdrawn from the market. If somebody gives you 2000 rupees, what is gram variation? 500 will be there. 500 also will be slowly, in a couple of years, it is going to be withdrawn. Only maximum is like $100, like in the US. So most of the transaction will be digitalized. Phone Pay, Google Pay, GP, whatever. No, so many pays are there. Okay. Now, the gram. What is gram variation? Next question they ask. Everybody, when gram-positive organism looks like gram-negative, it is called gram variation. Vice versa do not happen. Gram-negative will not look gram-positive. क्या जरूरी है सब सीखने के लिए? It's not at all, because it's a part of 20 marks. 20 marks. We want distinction. You should get 18 out of 20. Scoring, high scoring marks, gram staining. Give sometimes 20 out of 20 also, if I am there. Chal. When gram positive, everybody repeat, gram positive organism looks gram negative. Please don't write this G plus, G minus like in the examination. Some people do not like. Of course, I don't mind. Some of the examiners are they are very fond of their microbiology. They are microbiologists. I'm shit subject, whatever it is. They are very fond of their subject. They don't like people writing SMS, WhatsApp G plus G minus. They don't like, okay? They want full form, okay? They don't like. They get irritated. They get irritated by your short forms, okay? What is this G plus? What is this G minus? No. So they don't like. Some people are there, especially some of the old ladies examiner are there. In old age, yeah. So they stop that, they get irritated. Okay, I must have seen 300 exams, in my career. So the people get irritated and they look at me as if I am a villain. You have taught them like this, huh? What is this nonsense they are doing? No, you are not taught them well. So one of the examiner last time had come, he said, "You are going to fail. You are not done gram positive." The boy came and started crying. I said, "Nothing will happen. You pass. Go." So when gram positive organism looks like gram negative, it is called as gram variation. It is called as gram variation. In what condition it happens? Number one, old culture. Number two, when you grow the organism in presence of beta-lactam antibiotic like penicillin. Number three, over enthusiastic students when they put lot of alcohol and they make it over decolorize. Over decolorize. Old cultures, when they lose cells, they tend to lose cell wall. When grow the organism in presence of penicillin, then third is over decolorization. Enthusiastic student, and you will be decolorizing. You look at it. A friend will say, "Laga, laga." Whole bottle will be empty. Then you will call some more alcohol. Some more. Don't drink alcohol, and that is spirit. Okay. If you drink that alcohol, it is so strong. Then the examiner, gram training, you want a gram training? Now, the most important is what are gram positive, gram negative organisms. So there are 5 cocci: staph, strep, pneumo. Staph, strep, pneumo are gram positive. Staph, strep, pneumo are gram positive. Gono, meningo, gram negative. Staph is grapes, strep is serpent, pneumo is lancet. Staph is grape, strep is serpent, pneumo is lancet. Gono is kidney, meningo is half moon. Meningo is half moon. First 3 are gram positive. Next 2 are gram negative. Okay. Clear? Any doubts? Okay. So please remember these 3 things: post-staphylococcal toxin induced TSS, toxic shock syndrome, food poisoning, superficial Satyam Shivam Sundaram, superficial skin scalded syndrome. You remember with streptococci, ARF and AGN. Post-streptococcal sequelae: acute glomerulonephritis, acute rheumatic fever, not romantic fever, rheumatic fever, rheumatic fever. Pneumococci causes consolidation of lung, pneumonia. Instead of calling pneumonitis, we call it as pneumonia. Gonococci, sexually transmitted disease called gonorrhea. Sexually transmitted disease called gonorrhea. Then the meningococci causes infection of the meninges called meningitis. Infection of the meningitis. Now moving on to the gram positive bacilli. Corynebacterium. Corynebacterium diphtheria. Corony is thorn-like. Where do we hold like this? Hold. What is this? What is this? What is this? Then what is this? What is this? I love you. I love you all. Corony is thorn-like. It splits. It's everybody. It splits stem or shoot of the tree. They are arranged like L or V shape. In the poles, they have got metachromatic granules. Metachromatic granules or polar granules, Babes Ernest granules. Chemically, they are made up of polymerized metaphosphate, storage of energy, grows well in Loeffler's serum slope, LSS, Loeffler's serum slope. Other media that is used is potassium tellurite agar. They reduces tellurium, tellurite to tellurium. Colonies are black in color. Corony means thorn-like, but its bacteria gives leathery membrane in the throat. Leathery membrane, diphtheros means leathery membrane throat. And nowadays you don't see, I have seen at least 2 dozen cases of diphtheria. This leathery membrane falls on trachea, gives rise to acute distress, respiratory distress. Sometimes you have to cut with the knife, you have to cut the throat. So next is lactobacilli. Normal commensal in the intestine, but when you use a lot of milk chocolate, you get dental caries. Lactobacilli, it is present in the milk. Listeria monocytogen. Listeria monocytogen. It gives rise to meningitis. Then erysipelathrix. Erysipelathrix rosopathiae. It gives rise to skin exanthemata. Then Clostridium. Colos means spindle shaped, everybody. Colos means spindle shaped. 3 organism Welchi. Clostridium Welchi gives rise to gas gangrene. Clostridium tetani gives rise to tetanus. Tetanus looks like drumstick appearance because of terminal bulging spore. Tetanus follows trivial injury like shaving with rusted blade. One of the important causes of neonatal mortality when they cut the umbilical cord with a rusted knife or rusted scissor. Okay. Then Clostridium botulinum. So one of the deadliest poison, and nowadays it is used for treatment of wrinkles in old age. Botox treatment, not buttock. Botox treatment. Botox treatment. This will be erased. Okay. Clostridium melchi, gas gangrene, tetanus, botulinum, food poisoning. Botulinum, food poisoning. Then anthrax, zoonotic disease. Man get accidentally infected. It gives rise to skin. Anthrax is called malignant pustule. Malignant pustule. Lung is called as wool-sorter's disease. Hyde-Porter's disease when man carries animal dead bodies on the back. Hyde-Porter's disease, and it gives rise to hemorrhagic enteritis when he eats sheep infected with the anthrax. And it is used as a biological warfare. And these are the spore-bearing organisms. These are the spore-bearing organisms. Although MTB and M. leprae are gram positive, but they are not usually stained with gram staining because they have a thick mycolic acid. Everybody, although tuberculosis and lepra bacilli are gram positive, they are not stained with gram staining because thick mycolic acid in the cell wall. They are stained with Ziehl-Neelsen staining. Yes, Ziehl-Neelsen staining. If you don't know spelling, just don't make a mockery of your spelling. Why is it? You write Zidane staining better. Whenever you do not know the spelling, or you write like this, Ziehl-Neelsen staining. Sometimes good handwriting are a curse to the student. We read everything. Bad handwriting, we just give marks. So like usually girls' handwriting is good. Okay, my handwriting was very good in olden times. When I was a student, people used to take notes, whatever I write. But as I started practicing, I can write with both hands, left hand and right, ambidextrous. Yeah. Virus. Yes. So now gram-negative bacilli just go on. Some mnemonic, all enteric bacteria are gram-negative. Salmonella, Shigella, E. coli, Klebsiella, Proteus, Pseudomonas, all are gram-negative. Enteric organisms are gram-negative. Salmonella, Shigella, Proteus, Pseudomonas. So there are gram-negative cocci, which Coccobacilli, we remember with BBHY, mnemonic. Bordetella, Brucella, Haemophilus, Yersinia. Bordetella pertussis gives rise to whooping cough. Brucellosis, zoonotic disease. Undulant fever, rake-borne fever. Haemophilus influenza, bee strain gives rise to neonatal meningitis. Yersinia pestis, again multiple choice question. Bipolar staining, it gives rise to safety pin appearance. What? Safety pin. Where do you use safety pin? Don't tell me to tie the blouse or something like that. Safety pin, where do you use? So much of thinking. Safety pin you have seen or no? Where? Pushpa. Vibrio cholerae gram negative, comma shaped organism with monotrachate flagella, spirillum minus, rat bite fever. Spirochetes 3, Borrelia, Leptospira, Treponema. Borrelia recurrentis gives rise to relapsing fever. Borrelia recurrentis gives rise to relapsing fever. Leptospirosis gives rise to Weil's disease. Rats and bandicoots are reservoir hosts. Man get infected when he takes bath. When he has got an abraded skin, it gives rise to jaundice, bacterial jaundice. Treponema pallidum, one of the famous sexually transmitted. The person who knows medicine, syphilis knows medicine. Infects all the systems, genitourinary, cardiovascular, and in the end, it gives rise to GPS, general peripheral insane, and tapes dorsalis. Syphilis. Then Mycoplasma pneumonia is gram negative. It is cell wall-less organism. M. pneumoniae. Then this is one again gram positive. Actinomycetes. Actinomycetes and nocardia are branching bacteria. They are gram positive. And other two group of organisms which forms, some of the properties are like viruses, some of the properties are like bacteria. They are grouped under Rickettsia and Chlamydia. Rickettsia gives rise to typhus fever. Diagnosed by heterophile agglutination test called Wheel-Felix test. OX2, OX19, OXK are used. Heterophile agglutination test. Chlamydia, trick agent, trachoma inclusion conjunctivitis, ornithosis, psittacosis. Man gets pneumonia by bird dropping. Another organism is sexually transmitted disease, Chlamydia trachomatis. Chlamydia trachomatis. So you should know this is a overview of bacteriology also. Okay, move to the practical hall. Everybody is given a slide, stain, gram stain, observe the bacteria, whatever you see, write the diagram, show it to us. 20 marks, high marks. If you want to get distinction, you have to score 18 out of 20. Thank you.